And welcome to our Freedom Healthworks webinars. It has been a minute and we are so excited to kick these back off with our very special guest, Dr. Michelle Cooke, who's coming in from Atlanta and going to talk to us a little bit about boundaries today. So we are really looking forward to that. I think that we can all relate to that, whether you're getting ready to start DPC, you've had one for multiple years, or even your first year is really, I think, when you get the shake of, hey, I need boundaries. But really looking forward to talking about why that's essential, how you can enhance your patient care, streamline operations, and just boost your overall satisfaction for yourself as well as your patients. So I'll let Dr. Cooke introduce herself, and then we'll take it from there.
Thank you so much, Sarah. I appreciate being hosted today. So again, I am Dr. Michelle Cooke of Sol, S-O-L, Direct Primary Care here in Atlanta, Georgia. This is a really exciting time for me in my DPC journey, especially at Sol, because we are 1 year in as of this month. So I just had my 1 year anniversary. And with part of that 1 year, I have moved locations. So like many of us, I started as a micro practice, just a very small operation. I was subleasing from another physician. So I had a little room and an exam room in her building, but I was growing, she was growing, needed more space. I'm live from my new office. So one day I'll give you guys the virtual tour so you can see what's going on here. So I'm still getting things unpacked and just loving the DPC life. So big move for me. And a lot of that was possible just because of, this the beauty of the DPC journey allows you to grow as much as you'd like to. So I'm also really excited to talk about boundaries in DPC. And this is a topic that I've been challenging myself to learn a lot more about. When you teach something, you learn it better. So this is as much for me as it is for all of you today. But boundaries are critical, not just in DPC, but in every relationship. And I think when I think about boundaries, I start to think about, learning to say no and keeping that firm fist and just kind of like putting these walls up around you. And boundaries are not quite that rigid, but it's really the what helps define the safe space of a relationship. So I like to think about boundaries more like seeing that tape sign at the edge of a cliff that's like, don't go past here, like here's the boundary, because if we go beyond here, we're going to be in dangerous territory. So it's not just to hold you back for the purpose of holding you back. It's not holding you back because I want to be mean to you or I just want to push against you. It's really defining where the safe space is. And the more we get outside of safe space, we're going to be in trouble with our relationships, both in and outside of DPC. So one of my colleagues on a Facebook group mentioned something I thought was so beautiful. And she had said that boundaries, or burnout rather, burnout is usually the result of a lack of healthy boundaries. And I thought that just gave so much clarification to what happens in the physician journey, that many of us are not, well, we are burning out, but really one of the core reasons for that burnout is a lack of boundaries. And what makes it very difficult, especially if you're coming from the employed space, my story is I was an employed physician for nearly 10 years before I started my direct primary care, is that you don't really have the autonomy to create the boundaries. And so the boundaries are really messed up and it really hurts your relationship with the patient, which is why burnout and moral injury happens. So not being able to control your boundaries when you're in a position that doesn't allow you autonomy is a problem. And DPC solves a lot of those problems. The thing we have to keep in mind is as we're moving into DPC, we do have the autonomy to create these boundaries. So we have to be very clear and very intentional about the way we move into boundaries in the future. So I want to share a couple of stories about how boundaries have shown up in my physician experience prior to DPC and then also now in DPC. And one of my favorite stories about boundaries is talking or showing others the way that you need to be treated. And when we do this, we can have much healthier relationships. So prime example is when I was in my non-employed or my employed life, I had a patient, sweet elderly patient, always came late for her appointments every single time, just like without question. If it was a 3 o'clock appointment, she wasn't there till 4. Like it was just consistent. And every time she'd come, they would ask me, they'd come in the back and say, hey, Dr. Cooke, your patient's really late. Are you going to see her? And I was like, yeah, she's my old patient. You can't turn away an old lady. Let's go ahead and see the patient. So I saw her. But when I did that, and I continued to do that, I showed her that it was not, that the time boundary didn't matter, right? I didn't keep that boundary firm. And what happened over time is I really started to be careful, this is a safe space, but start to really resent her. And a lot of us start to get to that space where we're not really acting out of compassion, we're acting out of obligation of, I don't want to turn away an old lady, but this old lady messes up my schedule every single day. She comes in late, I'm already running behind, I'm going to be here later, staff is going to be here later, I'm not going to be able to pick up my kid on time. So she's really causing a lot of disruption. But the problem is I'm continuing to allow this disruption, right? So I didn't set a firm boundary by saying, look, your appointment was at this time, I can't see you if you're beyond this amount of time late. And so I'd read Brene Brown's book, The Gift of Imperfection, which talks a lot about boundaries. I really feel like it should be called Good Boundaries. But she talked about, setting that boundary helps the relationship work so much better. And so she's like, just give it a try in your life. And so the next time my patient came, she was like 30 minutes late. And I said, you know what, I cannot see you today. Your appointment time was at this time. You're so much later. There's no way I can be able to give you compassionate and great care with you coming so late to your appointment. So of course, when that happened, she was really upset. You've always seen me at this time. Why would Dr. Cooke do this to me? So it created a lot of conflict. And as a person who's a people pleaser naturally, that was really hard for me because I usually allowed her to have her way. But then when she had her next appointment, you can imagine what happened. I set the boundary. She was on time for that next appointment. And by the time I got into the room, I was actually calm. Usually when I start those encounters with her, like I'm gritting my teeth, like, oh my gosh, we're so late. But now I'm here, we're ready. You came on time. We respected the boundary. This is our safe space to have care, not when I'm running behind, not when now I'm a false double book because you came at someone else's appointment time. We can really enjoy this encounter together. I'm not acting out of resentment. So that's a simple story, but I think it calls to demonstrate that if we create that boundary, we can have more meaningful relationships. And if you're someone that struggles with people pleasing like me, a lot of times we put our own care on the back burner for others. And we really get to that point where we're not really acting because we want to act in the other's best interest. We're responding to our own guilt. And that's not a healthy place to have relationships from. And I'm so guilty of that. I've done it a lot. So as you move into the DPC space, you do have the autonomy to be able to set the boundaries that are appropriate. The interesting thing about boundaries is it's going to be different for everybody. And with boundaries, we have to start with what our priorities are. So you really have to think about what are your top priorities, not only in life, as far as personally, but also professionally. And from that, you can start to build your DPC to match that. So as I mentioned, it will be different for every person. So for me, some of my top priorities are time with my family, time to get exercise. I want to be home on time. I want to make sure I have more time with my patients. So my visits are scheduled much longer. And so when I keep those in mind, I start to set up my DPC accordingly. So for instance, if you are somebody that's a morning person and your evenings, you're just not your best self, you shouldn't be having late hours. And you may think when you start your DPC, it's like, oh my gosh, I have to be so accommodating to the patients. I have to be there like all times of day. So I'm going to offer appointments until 7 or 8 p.m. because that's what my patients need. What happened is you told them that your boundary was up until 7 or 8 p.m., knowing you're no good after 3 or 4 p.m. So who are the people that you're going to attract? You're going to attract those people that want to come at late appointments. And when you hit that wall where you're like, gosh, I can't be at the office any later. I need to blow this thing up. I'm going to cut my appointments off at 3 o'clock because this is just way too much work for me. Now we've created a problem and we have to look back and say that we were the problem. We didn't think about what our priorities were. We didn't think about how we work best and build based on that. So let's say you built your clinic and you stop your appointments at 3 p.m. I see patients from 8 to 3. After 3 p.m., there's no more appointments. Who are you going to attract? You're actually going to start to attract those early risers, those people that like to get up early and get their appointments out of the way quickly. And you're going to build your practice on patients who are aligned with you and not necessarily those late day people. So again, that's going to be different for each doctor. If you're that early morning person, you're going to attract your early morning people, set up your practice that way. If you're the late person, and set it up the opposite way. You may not mind being there late. You're not the morning person. You don't want to talk to people before 10 o'clock. If that's you, you're going to change the way that it looks. So I say that to say boundaries look different in each DPC. We say if you've seen one DPC, you've seen one DPC. But I really want you to start with where are your values? How are you going to work best? And then build your practice around that, because that's going to allow you to show up to be the best physician you can be. The second piece I love about boundaries is that we must invest in our well-being. And this is going to be in my DPC talk. So if you're coming to the summit, you're going to hear some of this again. But invest in your well-being as your enabler and not as a reward for achieving something. So I'm going to say that a couple different ways. What that means is if we're putting our self-care and our own priorities first, we are going to be the best doctors. We're going to be able to perform the best. And the way this shows up for us physicians, a lot of times we say, you know what, I'm going to skip my workout because I've got too many notes to do, or I'm not going to go to church or whatever religious ceremonies you're part of on the day of the week because I've got too much going on, or I have to dedicate time to this type of stuff. But if you are doing those things that feed your soul, those things that are good for your body, you're actually going to show up better at work and be more efficient. Think about how you feel when you haven't got a good night's sleep. Oh, I stayed up late finishing notes, or I stayed up late finishing my website, and I show up tired. You're actually going to be much more sluggish. You're not going to be as present with your patients. You're not going to put your best foot forward. So if you're really investing in your well-being, that is what will enable you to show up and be the best doctor. That should not be the reward. It should not be, okay, when I finish all my notes, then I'm going to go to sleep. Or when I get all my work done at the office, that's when I'm going to start doing my exercise. No, those things are your big rocks that need to be done first. And if you do those first, you'll be amazed at how much more efficient things are and how much more smoothly life runs. So that's another thing I want to talk about with boundaries, like put your self-care first, because if you're doing that first, you're going to have so much more endurance and you're going to be much more efficient at what you do. One of the last things I want to talk, well, a couple of things, but one of the last things I want to talk about that's cool with DPC is that we have so much more opportunity for automations and leveraging technology to help firm up our boundaries. So with boundaries, you are responsible to your patients. So in DPC, you're responsible to your patients. You're not responsible for your patients. And I think that's a clear distinction to make. You're responsible to, not for. And you can really help technology leverage that. You do owe it to your patients to let them know that you are engaged, that you know what's going on, that you're going to follow up with them. But it may not be at all hours of the day. So as I mentioned, for me, my boundaries are protecting my time with my family, especially after hours. So a lot of us go into DPC thinking we have to be available 24 hours, anytime someone can call us, we have to respond. That's just not possible. Even ERs that do that have to staff it with lots of people to make that possible. We cannot be on 24/7. So at my practice, I use a messaging software. My text messaging system allows auto replies. So if you're not using auto reply, we need to start using auto replies. So if you text my office after 5 p.m., it will tell you your message has been received after business hours. We will get back to you at the next business hour with your concern. If this is an emergency, call this number. So again, I'm responsible to my patients. They text me, they had a concern. They need to know that I've been aware of that. So that's what the text message does. It gives that message of Dr. Cooke's aware of this, but here's when she's going to respond to you. I've given you that time frame, which sets the boundaries of when the operating hours are. But then I've also given that caveat. If this is an emergency, pick up the phone and call. Sometimes the convenience of text message means that people are just going to text all the time. So I will say, when I started my DPC journey, I was using a system that did not have a robust auto reply to it, and text would come through at all times of the day. It would just go directly to my cell phone. So I could ignore them, but you know how it is. Once you're alerted, like it's on your mind. Like you can't stop thinking about it. And that was a problem for me. So I had to start looking for technology that was going to support my boundaries. So in that technology, it would alert me all the time. It drove me absolutely insane. But now with my current text messaging system, my patients get the auto reply and I can silence it. So on weekends, I don't even see those texts coming through. So it really protects my personal space. And that's a boundary I had to create for myself. I had to put that up because even if I'm not responding to the patient, just me being aware of it was like kind of interrupting my mental space. And that was not enabling me to show up to be my best self by the time I get to Monday. You return to work and you're like, oh my gosh, there were 20 messages that came in this week and I barely even got time to rest and I'm not showing up as my best self. So find ways to silence that. Another way I leverage technology to help support my boundaries is using schedule send. So there might be some times where you were forced to work after hours, right? You had a busy day, there was a lot going on in the office, there's some things that led you away, and now you have this time after hours where you're getting back to patients. You don't want really your messages going through to patients, at midnight or at 8 o'clock, if that's not what your business hours are. So a lot of times if I'm responding to people after hours, I will schedule send so that they will receive it during business business hours. You may have those times where you're doing a patient's lab results and you're going to discuss their lab results and you send it to them and they get it right in that moment. They ping you right back. Oh my gosh, Dr. Cooke, what does this mean? What do we need to follow up on? And if that's happening after hours, now you've opened up the boundary that I'm open after hours to discuss your lab results with you. Whereas if I send it for the business day, when they get it and respond to it, now I'm getting those responses during business hours and I can respond with compassion because it's not outside the boundaries of when I want to respond to that patient. So those are ways that I like to leverage technology. There's so many other ways that you can do that too. But technology has really allowed me to maintain those healthy boundaries. So using auto text and auto replies, using schedule sent, and then silencing things when you don't need it. So even outside of DPC, I talked about silencing my phone after hours, and only phone calls will come through because those are the critical messages. So I'm available for the critical needs, but not for the minor needs. But even in my personal life, I have set my phone to weekend mode. So in my personal life on the weekends, my phone, it will receive phone calls, but I programmed it so I will not receive text messages and alerts. So emails and text messages, I just don't even see that. If I open my phone, I can go to it, but I'm not being pinged all weekend. And I can't tell you what that's done for my peace of mind, just to not be alerted all the time. So that's another way that we can leverage technology to protect our space. If we keep allowing those alerts to come in, we're not going to be able to achieve the peace that we need. Just the other day, I was talking with a patient who's not in medicine, but struggling with her work life because she just felt so overwhelmed and so anxious all the time. And really, she's experiencing some of that alarm fatigue. Every time she gets an email, she feels pressure to respond. Every time she gets a message, she feels pressure to respond. So she feels like she's always on, always on, always on. So much so that she's considering making a career change. She just feels like this work has been way too overwhelming for her. But what I said to her is, you really need to check that part right there, because yes, people can email you anytime, people can message you anytime, but you have to set the boundary of when you are going to respond and reply to those things. Because if you don't manage that here, you're going to carry that behavior to whatever your next position is going to be, and you're going to find yourself burned out again. So we see this not in medicine, but in other aspects of life and in other careers. Is that lack of boundaries is what helps lead us to burnout. And if we can shore up the boundaries, we can really delay experiencing burnout in primary care. The last thing I will say, and I hate using this, the learning to say no, but we have to talk about how to say no. Saying no, again, as a recovering people pleaser, is really, really difficult for me. But I've learned that no can be one of your most powerful tools. For me, when I use no to help maintain my boundaries, again, I start with my priorities. And I'll give a great example of this transition I did to my new office. So when I realized when I was able to get the lease for my new space and it was time to move to the new space, I knew that month was going to be on and popping. I've got to get the movers to come in. I've got to get the painters to come in. I've got to order all these supplies. There's a million and one things I knew I had to do. So my to-do list was super long. So what I told myself was, Michelle, anything else that's not related to getting my office open has to be put on the back burner. So I was invited to dinners. I was invited to professional events. I was invited to speak at certain things. I was like, look, nothing can happen. Nothing else can go on my schedule until I get this done, because my top priority right now is making sure I have a clean transition into my new office. That's when it's going to make sure that I have good peace of mind. It's going to make sure my business is stable. And if I'm burning my candle at both ends, trying to keep up with all the social activities and the business activities, like by the time I got to the office, I would just be wiped out and exhausted and, feel resentful because I just felt so burnt out. And so having to say no to the things that weren't my priority was challenging, but also very empowering, because I remembered why I'm doing it. So it's not just saying no for the sake of no, of like, I'm just going to be the mean girl and cut you out. No, no, no. I'm not doing any of that stuff. But you're saying no, it's like, not because I don't want to or because I don't like you, but my priorities are different right now. My priority is this space, and anything that's not related to that cannot be on my to-do list right now. So even, Sarah was affected by this. We
I was gonna say
when we scheduled this meeting, I was like, look, Sarah, we can't do nothing until I'm situated in my new office, because that is my priority. So I had to make sure I shifted things around. So you start to realign things with what your priorities are. And there are times where you look at stuff that might be fun to do, but you're like, this is not really in alignment with what my priorities are. We all only have 24 hours in a day. That's time to sleep, work, be with family, exercise. And sometimes adding those little pieces in will chip away from one of those big, big rocks that we have to take care of. And even though it might be fun or it might be good, learning to say no if it's not in alignment with your priorities is really, really really empowering. So it's not a mean no, it's not a combative no, it's a no, because this is where my alignment is. And if this is not in alignment, it's not going to work, and it's going to knock me out of what's keeping me. So
Yeah,
those are
that's
my key points about boundaries. So thank you for letting me go on that spiel, Sarah, to talk about that. But I'm glad to answer questions, or if you have any thoughts about what I just mentioned, I'd be glad to respond.
Yeah, that's great. I mean, that's such a good reminder. I can think of so many different ways where this applies, especially for people who are just starting DPC or who are
Mhm.
even further down and have kind of gotten in the swing of just saying yes.
Yeah.
You probably saw me laughing a little bit while you're talking because Kinsey is on here, who's our director
Mhm.
of clinical services, and she is the boundary queen. And she's texting me now saying, "Are you taking notes for this for yourself, Sarah?" I'm like, "Yeah, call." But so true. And it is so hard. But I think one of the things that you do when you are setting those boundaries is you encourage people who you're setting the boundaries with to do it for themselves too. So,
Right.
when you told me, "Oh, I can't do it until after this is done, this is my priority," it made me think a second, okay, maybe I should pick that up. Baseball season is probably the biggest one that's weighing on me right now. But I know you're a boy mom too, so you're in the middle of all of this, but it's prioritizing those things. And a long time ago, this is a quote, I don't even remember where it came from, but someone told me, when you're saying yes to something, you're saying no to something else,
Yeah.
which is another way to really align. So rather than just saying yes right away, what I've started doing is asking myself, what am I saying no to? And that
Mhm.
pretty quickly tells me if I want to really say yes or not, rather than just going on, I just want to say yes because I want to keep them happy.
Right, right. I love that. This is especially difficult for people pleasers, because I talk about it
Yeah,
from the, like I said, the perspective of a recovering people pleaser, because sometimes what you're responding to is your desire to make them happy and not what your own needs are.
right.
So you show up to these events and you're like, I really could have been in bed today. I really could have been doing my run, or I
Yeah,
really could have been reading my book. So there's always something you're saying no to.
right.
So it's that balance, and the more you can get in alignment with what your goals and what your priorities are, it's just going to make you much more efficient. But I
Mm,
find as a recovering people pleaser, I would say yes all the time, but like deep down, just be like angry, like, oh my
yeah.
gosh, I have to do this. Why do I have to be here? I don't really want to do this right
Yeah,
now. But the guilt is what kept me there. It wasn't because I truly wanted to be there. So now when I say yes to things, I'm really showing up with my full self. Like they're getting the best of me, and not kind of the,
right.
the one that's here because I was dragged along by my own like problems with guilt that I have to work on.
Right. Yeah, you're able to really be present rather
Right.
than thinking how much longer till this ends. And I think that's really a good way to kind of check yourself of,
Right.
for everybody, I think handles that guilt and that stress differently. I think as moms, especially, we get in that mode, but where in your body it's telling you like, okay, I just want to go. If you're looking at the clock, then you need to sit back and go, okay, wait, maybe I should evaluate why I said yes to this so I
Yes.
can prevent this in the future. I think the biggest place that we see this at Freedom when
Mhm.
we're helping people open their practices is with meet and greets. So, a lot of people in direct care offer options to come and meet with the patient, for the patient to see if you're a good fit, but also for you to see if the patient's a good fit for your practice.
Mhm.
And I can't tell you how many times people will say, Sarah, they're just not signing up. I met with them for an hour and a half and we did this, and their cousin and their neighbor and everybody's health history I know now. And you have to set that boundary of, this isn't a visit. This is a time for us to see if your health goals and my practice align and how we can get you there together. Would love to get you on the calendar for a actual patient appointment when we can have
Oh
the
yeah.
time to dive into that. That we really, especially our patient sales team that Kinsey manages, they are very strict about making sure people know this is not a doctor's appointment. And a lot of times when you're thinking, oh my gosh, I've got to get to break even faster, I've got to get to profitability, you think you've got to just say yes to everything, when in reality, once you are growing and you have 200 patients, you're not going to be able to give Mrs. Smith all that
Right.
attention like you gave with your example when you have that, and then they're going to feel slighted. So
Right.
keeping that from the beginning is so important.
So true. And I mentioned it a little bit when I gave the kind of the spiel before we started in the dialogue part, is what took me a while to realize is you do want to attract what fits you, and that's what your boundaries do,
Mhm.
because there's some
Or
people that will show up and say, oh, you don't offer evening hours, I'm going to go away, or you're not going to spend 2 hours with me every visit, I'm going to go away. And then sometimes if that's not what you do, you kind of want those folks to go away, right? You're not a good fit. It's okay not to be a good fit for everybody. I think I'm a great doctor. I'm not the right doctor for everybody. I'm
Mhm.
very emotional. I really want to get to know people's feelings. We're going to talk for a while. And some of my patients are like, look, I just want to cut and dry, get me in, get me out. If that's who you are, I'm not the right doctor for you. I'm going to drive you nuts with my, like kumbaya and let's hold hands and talk about our feelings today. Like, I'm not the right doctor for everybody. And so I think it's funny when you mentioned the meet and greets, because I actually had to put my meet and greets on pause because of some of those very reasons.
Yeah.
One of the challenges was, I wanted to keep my business day open for patient care. And so I
Mhm.
put my meet and greets at the end of the day. So remember, for me, end of the day, that's usually my time that I'm wrapping up. I'm getting back to my family. So putting at the end of the day started showing my patients I'm available at the end of the
Mhm.
day. And I remember one of the ones that went totally haywire is I had a patient come. She had a late meet and greet. So it's end of the day. I'm already like a little, like, I don't really want to be here anymore, right? So I'm not showing up with my best self, but I'm trying to drive the sale because I want to build my practice. And so she comes and she's very, very anxious. She has all these worries. So my people pleasing pops in. So I like want to quell her concerns. And we go on for almost an hour with this meeting. So now we're really late into the evening. And she ends up signing up. So I'm like, yes, it's a win. I convinced her to stay. But that particular patient always wants my latest appointment.
Mm.
Ends up coming pretty late, comes with this trail of listings she wants to take care of. Like, it's not the quick stuff at the end of the day. She wants to have like this full, come to Jesus meeting at the end of the day. And I had to tell myself, I didn't set the boundary well,
Mm.
like I did this meet and greet late in the day. I let her know that I was going to be available way longer than I told her I was going to be available for. So her impression was, whoa, look at this kind of service I'm going to get. And it's kind of made a dysfunctional relationships. I've had to start walking that back. So if you start with the right boundary, you're going to attract the right patients. You're going to be really aligned with your patients, and it's just going to work so much better. So yes, I broke my own boundaries and paid for it. I still have a good rapport with the patient, but I really had to be aggressive about getting us back to where it was pulling me back in alignment. That may ultimately mean that she leaves my practice, which would
Mhm.
be a little sad, but at the same time, it just means that we are not in alignment. And if you're not in alignment, then it's time to separate, and that's okay.
Sure. Yeah, I think we did a webinar last year around marketing, and it came up about Google reviews and people who weren't for you that were leaving Google reviews. So,
Mhm.
of course, you want to ask everybody for one, especially those people that love you, but it actually gives this credibility when you do receive one that says they're not the doctor for me. And if you want to see more about that, you can go back on our YouTube page and find that. But her response to someone saying criticisms about the practice was, I really hope that you find a doctor that's a good for you. It's totally okay that I'm not, wish you well.
Yeah.
And just being able to take that instead of really personally when you're first opening,
Right.
especially, is so important. And I think that that is a boundary of not taking offense to not being the right fit, which is so
Exactly.
hard when you're just trying to grow your daggone practice and do a good job.
Exactly. And that's a huge difference for me compared to fee for service. And something I think is so freeing in DPC is, again, you can attract the patients that work best for you, right? When we talk about marketing, especially, one of the biggest thing is like, who is your target? Like, who are you going after? You need to be very
Yes.
clear about who you're going after, because you can't go after everyone. But if you're coming from fee for service employee medicine like me, everybody was your target. So anybody whose name was
Mhm.
on, or your name was on their insurance card, you had to be the doctor for them. And so I
Mhm.
think it teaches you to deal with different kinds of people, but it also makes you less effective because, like, all comers are coming towards you and you're just not a good fit for some of these people. And back then I didn't really have the autonomy and the power to say, this is not a good fit. It's like,
Mhm.
nope, we assigned you this person. You need to
Right.
make it work. Like, and there was just so many barriers. And so this behavior came out of it of like, I have to meet everyone's needs, even if
Mhm.
it wasn't in alignment with my needs. So what's great about DPC is I think people get better care, not only just because
Yeah.
DPC is just the best model, but because people finally get to align with a doctor that's perfect for them. They get to shop around and say, oh, Dr.
Mhm.
Cooke does this and she loves yoga and that's my jam. Or, Dr. Sarah, she's all about baseball and like, I'm a baseball fan too. And we can talk about that when we start our visits, and that gets me motivated. So I love that it allows our personalities to shine, and that attracts the right patient towards us.
Sure.
And it really helps stave off burnout because you're not serving people who aren't in alignment with you. So that's
Yeah.
one of the biggest things about DPC that I did not expect, or
Oh,
that was kind of hidden to me because I was so used
sure.
to like, no, anybody that comes, you've got to try to meet their needs no matter what it is. Like all comers are coming towards you, but no, you're actually going to bring the people towards you that are in most alignment.
I think that's really good. We hear a lot of people thinking, a lot of times it's spouses, not the actual physicians or nurse practitioners starting, but that are saying like, that's too specific. You got to appeal to everyone. And in reality, the people we see that niche down more, when I was eavesdropping on your website, you're focused on yoga and you have a lot of things that you integrate into your practice that you won't find anywhere else. And in reality, that's what brings your people to you.
Yeah.
I'll shout out Dr. Holly Smith, who's in Carmel near us. She has a program that's specific to Catholic family planning and fertility issues. Very specific niche. She grew at the most rapid rate, I think, of anyone in Freedom Healthworks history. And, it's those when you're able to really get clear on who your ideal person is that you're serving or your ideal patient population, you can really just grow so quickly because you have those boundaries in place and you're able to identify who you want to bring towards you. And those people are going to shout it from the mountaintops.
Oh yeah. Oh yeah. And that's tough for us, because many of us who are in DPC, with it being primary care, coming from a family medicine background, right? So many of us are the jack of all trades, like
Right?
everything in medicine is fair game. So it can feel very unnatural to kind of niche down. And you can still keep a lot in your practice. It's completely up to you about what you want to bring forward. So again, starting with what your priorities are. If you want to be that jack of all trades doctor, you can certainly do that. And there's ways that you're going to market towards that. But sometimes the more specific you get, I think it is really nice because it does create just such better alignment. And like you said, you're going to attract those right patients. They're gonna bring more people to you. It's just going to grow astronomically just because of that synergy.
Yeah. I think we've got a couple questions coming in here too, and I'm going to keep an eye on the time. And good questions, guys. Thank you. Go ahead and continue to put those in. If there's any we don't get to, we will respond by email and give you answers that way. But the first one says, what's the best way to initiate a boundary conversation when you find it hard to speak up? It's a great question.
Excellent. I think it really depends on what the situation is. In general, if we're talking about DPC, I think the boundaries really start with the way that you structure your practice. So it's what are your hours? So that's a big one. Like what are the times that I operate, and how do you reach me during the time? So communication is very different in DPC. This is the first time in my life I've ever texted with patients, but being very clear about if you are texting, here's what's going to happen with texting. When patients are onboarded, giving them that patient welcome package. That's really where you start the boundaries conversation. So you've come on board. This is how you reach me. This is the times we're going to respond to you. Here's who you expect to talk to. Here's how quickly I'm going to be able to respond to those, refill replies. So starting the conversation up front rather than waiting for a problem to happen and hitting it on the back end. When you have that up front, you can always refer back to that. So no one can say, oh, you lied to me, or you promised me the world and now you pulled back. So you have to find a nice balance of starting restrictive with a little bit of flexibility. You want that rubber band. It has a little bit of give to it because you do want to have some flexibility for your patients. But I think where we fail in DPC is we try to meet everyone's needs. You try to say, oh, no matter what, call me anytime. Anytime you want to have a visit, you can be here as long as you want, as many as you want during the week. And so if you start with that, you set that expectation that it's a free for all and I can get whatever I want whenever I want. But if you start with the expectation of, okay, here are the outlines of how this office is going to work, people set that in their minds and then they start to structure towards that. Oh, I know that Dr. Cooke closes at 4 p.m. So I got to make sure the days I come for my appointments that I restructure my work this. They will meet your boundary, but you have to be very clear about what that is on the front end. So I think if you start on the front end, it's easier. You're not doing it from a place of like, anger or like putting up like a bold, wall between you two, but just saying, this is the safe zone. Like, this is where things are going to be safe. The further we get away from this, now we're off the cliff and now we're in a danger zone. So start with the safe zone. We're going to present it as this is how things work well. When we follow these things, I'm going to be able to give you the best care. But if I'm getting called at 3 o'clock in the morning every night, because that's when you wake up in the middle of the night, I'm not going to be able to provide you the best care. If it's an emergency and, you're toe is falling off at the time, okay, call me. But because you were cold that night, or had one more hot flush, like that doesn't deserve a
Yeah.
phone call. So just being very clear about that.
Or need a refill.
Right. Or need a refill in the middle of the night. It's like, nope,
So
that will be
I'm guilty of that one
Excellent.
for our pediatric DPC. I'll say, I know I'm texting you after hours. Do not respond to this. Do not think about it. I just got home from work. I just need
Yeah.
a refill, and I know I'm going to forget you tomorrow, but please ignore me.
Yes, and thank you for saying that. That's why I love my auto reply.
Yeah,
Because sometimes it's not that the patients necessarily want to aggravate you after hours. I
right.
think most of us are busy during the day, so it's like, oh, I don't remember until 6, 7,
Yeah,
8 p.m. And that's the time I'm going to send the message. So allow them to do that. Know it's going to be collected and you'll respond to it. But a lot of times they're afraid to send the message because like, oh, I don't want her to respond right now. But if I wait till tomorrow, I'm going to forget. So you leave it open for them to be able to use your service appropriately, but you let them know based on your boundaries when you're going to reply to it. So it just works
yeah.
really nicely.
If anybody is on this call today from any of the messaging apps, make it so that the patients can schedule ahead too. I really wish we had that. I know as providers that we can on the back end, but I wish that they do that for patients.
As far as patient scheduling, you said?
Yeah, if I send a message requesting a refill, I have
Mhm.
to send it at that time. I can't schedule it to go out during this
Oh,
hour. And I wish that we had that so we didn't have to bug them, but that's why it's so important on your end that you keep that boundary and
right, right. So
yeah.
interestingly, I'm an iPhone person. I might be switching. I'm
Mhm.
now Google based now. So this is not
Oh,
endorsing any one
no.
of them, but I have an iPhone, but my platform at the job is now Google based. I've understood that you can actually schedule text message
Mhm.
with the Android phones. I can't do it with my Apple
Yeah.
phone, or there's ways to do it, but the workaround is impossible. So my husband's
Yeah.
team Android, he was like, yeah, well, if you had a real phone, you could you could do all that
Oh,
wonderful stuff.
yeah.
But yeah, on my Apple phone, I can't do that. So yeah, that's a great idea for patients to have that functionality.
Yeah, and I think just letting them know too, like you said, when you're coming into that first meeting, a lot of times we'll encourage people to let them know this is when you need to call the emergency room. This is when you click it's urgent on my after hours message, and letting them know that. And you're going to have to say that over and over again. If you have staff, make sure you're all using that same terminology.
Right,
Excuse me. It's just like parenting. They're going to
right,
ask the front desk person and they're going to ask the doc and they're going to have different answers. You're going to be in trouble. So
right.
make sure you're all aligned with that and let them know if you're okay with that, with them sending messages about refills and just knowing that's fine. You can send that, but I'm not going to reply to you until whatever time.
Exactly.
Next question says, how do you establish your boundaries around what patients you will take and what patients you won't take?
So I have never rejected a patient. So I will say that I'm still fairly novice in my DPC, so I've never rejected a patient. Um, but I think that, as I mentioned, the way you structure your practice, you're going to attract the patients that want to come to you. So again, I have to shift this. I'm not sure where this doctor is coming from or where the question is coming from. But when I was in the fee for service world, like all comers came to me. Whereas when people come to my office, they have made a decision to be there, right? Like they have to put some skin in the game. Previously, my patients, like, they found me on their insurance or I was the doctor that was available. Like they kind of got funneled to me, not really by their own will, but the patients that come to my practice usually have done some research, right? Like they've looked at the website, they've watched a couple of videos I posted, like they've kind of bought into it. And by the time they get here, there's a reason why they want to be here.
Mhm.
That may be a little bit affected if you're a doctor that has like employers that you bring on where some of those patients don't have like all the choice to come in, but most of the patients that have come to my practice have come here because they truly want to be here. And by then we're almost always already in alignment. So I haven't run into any patients I feel like I have to remove. Now, have patients left my practice? They have. The most common reason why patients have left my practice has usually been financial. They've hit hard times, they've run into an issue and they can't stay. I've had some people who've wanted to leave because they don't like the idea of a monthly membership. They're like, well, I'm not sick, every month. So why do I pay you every month? Not understanding the value of having that access to a doctor. And if that's what their belief system is I only want to pay for a doctor when I have that time, then you know what, we're not a good fit. And sometimes they self-select out of it. Although we get great guidance, from your malpractice carrier and from other DPC docs, if you are really feeling like it is not a good fit with a patient, you do have the room to say, I don't think this is the right fit. Talk with your malpractice about doing an appropriate discharge, making sure they have medications or refills for that time period, and just saying,
Mhm.
thank you. I hope you find someone that works for you, but you do not have to continue with someone that you don't think you're well aligned with. So I
Sure.
haven't had to do that yet. I say, I hope I never have to. However, you do have to be prepared for that because, again, that's just a part of maintaining appropriate
Right.
boundaries. And remember, there are some relationships that just need to end, and that's
Hmm.
okay. I think we always feel like, like it's a failure if something ends. No, something that's bad, stopping is a victory, not a failure. So if
Mhm.
it's really not working with that patient, and sometimes we know when that patient comes in, we're like cringing a little bit and we're like, oh,
Mhm.
like I don't really want to see that person. Are we really the best doctor for them? We may
Right.
not be the best doctor for them. So if that's what's happening to you, you really have to ask you, am I giving this patient the best care? And if that's not true, if you can't say an absolute yes to that, then you really have to consider whether you need to continue that relationship.
Mm. Yeah, that's good. I think, Dane, our COO, Dane Delosier, says this isn't a bad thing. This is a lesson and a blessing. And I
Right.
think those are things that we have to keep in mind. It's, I just had a conversation with a physician a few weeks ago who was in the traditional practice, still thinking about starting a DPC. And her final straw was that she had reported to her administration that she felt unsafe with a specific patient multiple times, and for the safety of her staff. And they had to go all the way through the ethics board, which we've all heard horror stories of.
Mhm.
And then they ended up coming back and saying, no, you can't discharge this patient, despite feeling that they thought something could happen.
Right.
And I think that's another thing. There's so much freedom in DPC, but that's another area of, unfortunately, that we have to celebrate, that there is that option that you do not have to stick with a patient. You can pick and choose who you decide to serve. And, hopefully it's not something where you're just, changing with the wind and there's
Right.
a
Right.
structure set up for that and a process. But in the event that that happens, we've helped people through that before, and just offering, that was a great piece of advice, to talk to your med malpractice person,
Mhm.
and making sure that they have options for other physicians they can go to. And
Right.
it just sometimes it ends. They're human.
Right. Right.
It's gonna
Because,
happen. So
like
coming
you
up with
said,
it now. Yeah.
boundaries are supposed to establish safety. Like, this is our safe space. These are the boundaries where we can operate. And once safety is compromised,
Mhm.
it's really hard to come back from that, almost impossible. So that's a
Yeah.
signal that we need to move on. So the fact that some of these healthcare systems won't protect us in that situation just
Mhm.
shows you that they do not care about your safety. That
Mhm.
boundary is violated. So remember, it's lack of boundaries, lack of healthy boundaries that leads to burnout. That's burnout. To say
Yeah.
I feel unsafe and I
Mm.
need to go see this, like, it's hard for me to even say that, to think that that's happening. I know it happens, but yeah, just totally unacceptable, and just
Yeah.
something that we don't have to live with DPC.
Yeah. One more question about the practice and patients, and then we'll move on to an interesting question,
Mhm.
a different type. So, what would you suggest for someone trying to decide on their first boundary to set? If they've been the people pleaser for a long time, where do they start to back out
So
of that?
again, we start with our personal and professional priorities. That's really where we start.
Mm.
And again, as I mentioned at the beginning, it's going to be different for each person. So for me as a wife and a mom and someone like who said loves to practice yoga, I need to protect my time for that, right? For someone who's single and has family that lives overseas, like, your priorities might be different. It might be that I need to spend 3 months out of the year away from the country so I can see my family overseas. But when I'm here, maybe my days are a little bit longer so I can accommodate for that. So every boundary is going to look different for every practice. It's really going to be reflective of that physician. But decide what your priorities are and protect those priorities. Remember, your self-care is what's going to enable you to be the best physician. So you got to start with what that self-care means for you. And it's different for everybody. If you're the
Mm.
morning person, then you need to be in the office in the morning and you just stop doing late night visits. If you're the evening person, it's going to be the opposite. If you're somebody that's like, you're quick minded and you don't want to be in a room for a long time with people and you're procedure focused, then you're making your practice about procedures. So
Mm.
you're going to lead up to those things that lead to your strengths and play into your strengths, and
Mm.
not play into the things that make you, that don't give you joy in your practice. So sometimes we're so pressured to try to do things that we don't want to do because we feel like it's going to bring us patients. But is it really a win if you've scored that patient off for something you don't want to do?
Mm.
If it's really a win when you're Dr. Cooke at 6:30 p.m. doing a meet and greet, knowing you just missed your son's soccer practice and I got
Mhm.
this patient, but now she always wants to be there at 6:30 p.m. Like, that's not really a win.
Mm.
So a win is building out your practice in a way that suits you, attracting those patients who are well aligned with you, and that's how you start your boundaries. So it's not really like the first thing you start with. You really start with who you are, what your values are, and build from there. I will say that that's so much easier said than done. So I know I'm saying it very simply, but for me, when I left the fee for service world, I couldn't even fathom how burned out I was. You know, sometimes you don't realize how bad it was until you get out and you're like, oh
You're
my
gone.
gosh, like
Yeah.
it's really hard for me to put into words the way I felt and some of the things I experienced. And I say that because it was so hard for me to even know what my personal values were at times because I had to compromise them so often. And so when I transitioned to DPC, I had about 4 or 5 months of, I was building up my practice, but I wasn't really working yet, and just really having time to heal and really remember what was important to me. So for me, that made me get back into my therapy. That's how my yoga really ramped up. I did a lot of coaching because a lot of times, many of us go to DPC, unfortunately, because we're running from something
Mm-hmm.
and not running to something. And
Mm-hmm.
initially, I felt like I was running from like how abused I felt, how burned out I felt, how angry I was, and my I don't want to say my values, but I thought my values were everything for the patient. You know, you have to always sacrifice yourself, patient, 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 and that's not necessarily true. I come first. I come first, and I'm okay saying that now. And if I come first and I set my practice where I come first, I'm going to be the best damn doctor for my patients because I'm so well cared for, right?
Yeah.
Nobody wants to see a burned out doctor.
Yeah.
So like if you do things that burn you out, you're not going to be great at what you do. So take that time to heal, take that time to really realize where your alignment is, knowing that, and this is another thing for me that's different conversation, but I was a little bit different than other family docs where I was starting to make a lot of money. My health system was paying me really well. And I have not made that much yet in my DPC, but I have never been happier. Like
Mm-hmm.
I've had difficult days here. Nothing has been as stressful as sitting in my car crying at lunchtime, not wanting to go back into the building. Like I never want to know what that feels like again. And it's not worth what they were paying me. Not at all. So I thought my values were I need to make a lot of money because I want to have this physician lifestyle. But I was like, oh my gosh, to be able to get to practice and start at 9 o'clock, to have my yoga. Monday mornings, I go for my nature walks and I feel really good. And it costs me almost nothing. So actually, my lifestyle has scaled back at first, because I was saving money. But now it's like, I really realized I don't need all the stuff I was buying all the time or spending all the time because I was filling a need that wasn't true, or that was there was an emptiness and not really a fullness. So my life is so much more full, even without that financial incentive. So I feel like people feel like, oh, I can't walk away from all this money, and we have to look at our financial boundaries too. But for me, I realized that the finances were actually less important. I still want to make money, I still want to do well, and that's coming, but it realigned things for me. So I encourage you to kind of take that time to heal, realign, see what's important for you, and that's how you're going to start to build your practice.
Man, you said so many good things there. I'm like still processing all of that. I mean, that it's so good. I know the best part of my job is watching that light come back to your eyes. I get to start I'm the business development manager. I'm usually one of the people that you talk to first if you are looking into direct care and looking for help starting up your practice. And I meet people locked in their cars crying at their lunch breaks. And I know every time we have a webinar, I say, I'm going to try really hard not to cry, but it's just such an emotional thing because again,
Yeah.
you're human.
Yeah.
And I'm meeting these people hiding in the closets or in their car at lunchtime. And then I get to watch the light come back to your eyes as you open that practice. And as you meet people who are, this team behind you to bring that hope into your life and not on your own. I think that's another really great thing about direct care is we're a collaborative group.
Yeah.
There's so many doctors. Dr. Cooke, actually, you didn't open your practice with Freedom Healthworks, but you and we all got acquainted through our CEO of Freedom Healthworks and just the passion behind we need more doctors, regardless of how you get there. We need to have more people get into direct care so we can see more of that light. I mean, Chris will say, it's life or death. And it is, it's such a sad, scary suicide statistic right now with physicians and with that burnout. And it's exactly what you said. You don't realize it until you're out of it when you're looking back. And I think that's just really important for people to understand that when you jump into this, you're not doing it alone. We're here to help you with those boundaries. We're here to, some of us, to point it out when you're not setting them right. And I think that's so important for this group. And I'm just watching our time here, so I don't want to take too much of your time. I'm really grateful for all that you gave us today, and you brought the truth and you didn't hold back, and I appreciate that. Tell the people who are here how they can find you if they have questions for you. I know you mentioned you're going to be speaking at a few conferences coming up.
Absolutely. So yes, I am sole. It's funny. There are actually two sole direct primary cares. So I'm one of two. I have forget the name of the doctor who's on the West Coast. But my website is sol-dpc.org. So that's my website. The easiest way to find me where I don't have to spell things out is probably going to be on LinkedIn. Michelle, if you look at me, Michelle Cooke, MD, you'll find me there. You can direct message me there. That's how I've contacted most of my most of the people who've gotten in touch with me. So LinkedIn's probably the easiest way to get in touch with me. I am on all the social media platforms, though, so Facebook and Instagram and TikTok. But I think the easiest way for my professional contacts is usually through LinkedIn. So please go on there, connect with me, and if you ever want to talk or talk about your DPC journey or have questions about the DPC journey, we can certainly arrange a call. I actually just got a message this morning from a doctor who saw one of my posts on LinkedIn. He's like, can we set up a phone call? I got a lot of questions, but I want to jump into this, and we're planning our call right now, so I'm available for that.
Love that. Okay, well, thank you. And we will send out an email here recapping our conversation with the recording. If there's anybody that you'd like to share it with, please do. We love sharing. And we'll get you also the information for how to reach Dr. Cooke, so you have that on hand as well. So thank you so much. And we look forward to seeing you at the conferences coming up.
I'll see you at the summit. Thank you, Sarah.
All right. Thank you. Have a good day.
Take care.